There continues to be significant progress made on the construction of the new South Niagara Hospital, but not all of the work is being done on site. The source traveled to a warehouse in Welland, where we were given a preview of what some of the rooms and treatment areas will look like when the hospital opens in 2028.
What were some of the features you showed off today that you think will make an impact with patients?
I think even just like I said previously, the little spot for a family member to stay overnight, that's a huge piece. And even for patients, having their private room, having their own space makes a big difference, like especially from a rest perspective. Or even just being able to spend that precious time with family, or even when you're having care provided to you, you feel a little bit more comfortable because there isn't somebody in the bed next to you. So you do have that bit of privacy and you can recover more quickly and you feel a little bit more comfortable, which I think will be huge, not just for patients, but for family.
It has been a lengthy process that led to today's media tour. Cardboard cutouts of rooms were shown to staff in January. That feedback helped guide Alice Dawn as they began a full build of patient, recovery, intensive care, and operating rooms. Niagara Health staff then provided a second round of feedback.
We feel that it is better to take this time right now and make sure that we get things right, because we don't want to be able to, finding out that we made a mistake where something should have gone on this wall but it was on an opposite wall later on, because that could really impact not only the design, the schedule, but also how staff provide care. So we think that this is a really beneficial piece, and it is also beneficial to our partners in Alice Dawn, because their designers are able to really take a look at the room and say, oh, I understand why this isn't working for you functionally.
Staff have been engaged throughout the process and have seen many of their suggestions implemented along the way.
They are really excited that, especially seeing that their comments and their feedback has been incorporated. It really does give that sense of accomplishment to the staff, because they are taking time out, and in some cases, they're putting in extra hours just because they want to be part of this build and they want to provide, kind of almost leave a legacy. And a lot of them are really excited about it. And I know that most of them that have been through here, they can't wait to try and play with everything. So it's been a really, really positive experience for them and good feedback.
How open are other new hospitals to sharing their information with someone like yourself?
Oh, extremely, we're extremely open. We have constant communication with our partners, hospitals throughout Ontario, and we share information with them, they share information back with us. So it's been great.
Visit Niagara Health online for updates on the South Niagara Hospital. Website features include future engagement opportunities and a live feed that allows you to see the construction progress being made. In Niagara, you're watching The Source on your TV.